Hi, I'm Dr. Joanna McDonald, chiropractor here at Teamworks Health Clinic.
Hi, I'm Sarah, Breathwork Facilitator here at Teamworks.
Now, in our lifetime, 80% of us are going to experience some sort of low back pain. And that's obviously a common thing that we treat here. As a chiropractor, I use techniques such as active release technique, manual manipulation or mobilizations, shockwave, and of course, I use exercise, education, and prescription. The techniques that can really be helpful with low back pain is breathwork. And that's what we're here to talk about today. When people think about low back pain, they usually think about rehabbing it with things like core stability exercises, working on their abdominal muscles primarily, or even their glute muscles. One thing that they don't think about is the fact that one of the core muscles is actually the diaphragm. Now, the diaphragm has two functions. The primary function is obviously respiration, but its secondary function, and this is where it becomes a core stabilizer, is trunk stability. So it really assists the transverse abdominis and the primary hip flexor psoas to help stabilize the lumbar spine. When we have low back pain, often we have a reduced control of the lumbar spine and reduced mobility. As a result of pain, trunk stability is often reduced and the diaphragm takes on more of a core stabilization role. This leads to abnormal respiration, and that's why we're here to introduce that breathwork component. So let's have a look at the anatomy.
Here we see the deep muscles of respiration and the lower back muscles. You can see how interconnected they all are. Here is the diaphragm. Notice how it anchors to the lumbar spine via the arcuate ligaments, which are reaching down from the diaphragm to lumbar vertebrae 1 through 3. It is here that the psoas attaches. The psoas, one of our primary hip flexors, connects the femur with all 5 of the lumbar vertebrae. When the hip is static, the psoas is stabilizing the lumbar spine. This is the transverse abdominis. It is the deepest and most stabilizing of our abdominal muscles. When you look from this lateral view, you can imagine how all 3 of these muscles would work together for both breathing and stabilization.
Breathwork involves conscious controlled breathing patterns to achieve specific outcomes, such as influencing your autonomic nervous system, altering the balance of oxygen and carbon dioxide in the blood, reducing cortisol levels, and additionally just overall improving your mental and physical clarity. There are many different methods of conscious breathing, such as paradoxal breathing, circular breathwork, also known as conscious connected breathwork, Wim Hof method, nasal breathing. But today we're primarily going to focus on controlled breath with the diaphragm. Step 1, find a comfortable position. You can lie on your back on a flat surface like a mat or the floor. Use a pillow under your head if it feels more comfortable. Now we can take a couple of normal cycles of breath. Take a nice deep breath in through your nose and exhale, release. Take a couple of more. Okay, for the next step, our hand placement. Place one hand on your chest and the other on your abdomen. This will help you feel the movement of your diaphragm. Now, once you feel settled, just take a moment to relax your body and let your arms rest comfortably in the positioning. Now, slowly inhale through your nose, allowing your abdomen to rise. Focus on the feeling of your hand on your stomach moving upward while the hand on your chest remains relatively still. This will indicate that you're using your diaphragm correctly. Now, upon that inhale, you can hold your breath for a moment if it feels comfortable. Just for a second or 2 is enough. Then exhale slowly, gently exhale through your mouth or nose, letting your abdomen fall. Again, focus on the hand on your stomach, feeling it drop as you release the air. You can continue to repeat this cycle of inhaling deeply through your nose, pausing and exhaling slowly. Aim for 5 to 10 minutes of focused breathing. If you feel your mind wanders, gently bring your focus back to your breath and the movement of your hands. Now, lying in the same position, form a triangle with your hands. Place your thumbs under your rib cage and let your index fingers point down toward your abdomen. The rest of your fingers can relax on either side. Now relax your shoulders. Slowly inhale through your nose, focusing on expanding your abdomen. Feel your hands moving outward as your belly rises, while the area under your ribcage remains relatively still. Hold your breath for a moment if you feel comfortable. Just a brief pause can help you connect with your breath. And on your exhale, slowly, gently exhale through your mouth or nose, allowing your abdomen to fall. Feel your hands move inward as you release the air. Again, you can continue this cycle of breath work for 5 to 10 minutes. Keep focusing on the movement of your hands to help guide your breath. And again, if you feel your thoughts drift, gently bring your focus back to your breath and the sensations in your body.